everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well and welcome back to another video. I'm back with some more cases for you, and this one here is a mastoid cavity. We've had a number of requests to look again at mastoid cavities. I've chosen this one because it's quite a nice, neat cavity. So most of the mastoid cavities that we've shown on the channel are really weird looking. You know, you go inside the ear and you think, what in the world is going on here? Doesn't really look like an ear, to be honest. And that's because the cavities that I've shown previously, these patients have had very, very radical mastoidectomies, very radical surgery for cholesteatoma and things like that. So this is quite a small but neat mastoid cavity, and it's going to give me a chance to answer some of the questions and explain a few things. So briefly, if you don't know what a mastoid cavity is, this is the temporal part of your skull. Okay, your skull is divided into various different bones. You know, this is your frontal bone, this is your mandible, you know, your occipital bone, etc., your ethmoid bone in between your eyes. The part of the temporal bone that houses the ear structures is called the mastoid bone, and you can actually feel it, this kind of lumpy bit behind your ear. That's the mastoid bone. And surgeons often drill into the mastoid bone for various purposes. If they're doing a cochlear implant, if they're wanting to access the middle ear for something like to, you know, take some of the bones out and put a titanium prosthesis in. It's called an ossiculoplasty or a stapedectomy with ossiculoplasty. Or you know what, there's various types of tympanoplasties which confuse me. Or they might want to drill the mastoid bone out because it's infected. Or in this case, I'm guessing by the look of it, they sometimes drill into the mastoid bone to get rid of a cholesteatoma, which is like a sort of growing mass of dead skin which is growing backwards, invading the middle ear space, and then it can grow backwards into the mastoid cavity. So what you end up with sometimes is, you know, you go into the ear canal and you can sort of see where the ear canal was, and there's an eardrum at the end, which is what this patient has. You can't see it yet. But then you have this sort of random enlargement of the ear canal, usually going posteriorly, so towards the back of the head. There's this kind of weird, I guess it looks like a backwards P, so to speak. And in this particular patient, the cavity, surprise, surprise, is filled with debris, which they often do, to be fair. So, and we get a lot of these. So, you know, this patient, I think, had his